First of all, try to avoid those triggers that can lead to asthma symptoms. And you should understand the type of medications that are being prescribed by your family doctor. There is a type of medication we call controller medication. You need to use them daily. And there is another type of medication, we call them the reliever medication that you need to use when you feel that your symptoms are flaring up. Ask your family doctor to provide you with a written asthma action plan. Understand what the plan is and follow the plan accordingly. You should adjust your medications according to the asthma control. And if you fail to get relief from the adjustment of medication, you should proceed to consult your family doctor again. Of course, when your child is not well, your child should take a rest and avoid strenuous activity. But if your child is very well in terms of asthma control, your child can actually take on any physical activities such as exercise, sports events. So these are all right and actually are good for their growth and well-being. If your child is not well, having asthma symptoms, your child should take rest and avoid any strenuous activity. On the other hand, if your child is well and asthma control is good, your child can actually take on any physical activity or any sports that he or she may like. Or if the asthma is induced by exercise, your child should take on the reliever medication prior to the exercise so that the airway is open and he can continue with the exercise. These are traditional remedies that have been passed down from the generation. It is widespread among the Chinese. So we do not discourage you from taking this food, but there is no advantage in controlling asthma when you take them. But up to now, there is no medical evidence to show that they are effective in preventing asthma. Many patients or their caregivers are concerned about the side effects of inhaled asthma medicine. They are worried that this medicine may affect the growth of the child or the patient. This is a result of inappropriate use of oral medication rather than the inhaled medication. The doses of inhaled medications is small and they normally do not affect the growth, and the doses are normally adjusted according to the asthma control by the family doctor. These doses do not normally affect the growth. The inhaled medications may also lead to white spots on the mouth, which the doctor will look out regularly. But such side effects can be minimized by rinsing off the medications after the use. Such occurrences are also uncommon. How do you assess your child's asthma control? We can use a standardized questionnaire known as the Asthma Control Test to assess your child's asthma control. For the child, this comprises 7 questions. The first 4 questions assess the child's asthma symptoms. For example, how is your asthma condition today? How much of a problem is your asthma when you run, exercise or play sport? Do you cough because of your asthma? Do you wake up during the night because of asthma? The last 3 questions are being focused on the caregiver. So we ask the parents or the caregiver, during the last 4 weeks on average, how many days per month did your child have any daytime asthma symptoms? During the last 4 weeks, on the average, how many days per month did your child wheeze during the day because of asthma? During the last 4 weeks, on average, how many days per month did your child wake up during the night because of asthma? So this series of questions will objectively assess your child asthma control, but it's important that you keep a diary of your child asthma symptoms. This can be provided for by your family doctor.